So how do we define the validity? Validity is nothing but it is a degree or an extent to which the tool or the instrument measures what it is supposed to measure. In the simple way to tell that वो जिस काम के लिए बना है उसको ही वो माप रहा है, उसी को हम क्या कहते हैं, वैलिडिटी कहते हैं. फॉर एग्जाम्पल, can you measure the inch with the help of the inch tape? Can you measure the weight? Can you measure the weight with the help of inch tape? Inch tape. Do you understand inch tape? Can we measure the blood pressure instrument with the help of the blood pressure instruments? Can we measure the temperature? Are you okay? You means, did you get it? What I mean to say means for what purpose particular instrument is made for that only we are using that. That is called as what? Validity. Got it? Okay, so that is called as validity. So for what thing, for what purpose the particular instrument, you may say, is intended to do its specified work, we are calling it as what? The validity. Is it clear? Now next, reliability. Okay. For example, we are taking the same example of the weighing machine or the PP apparatus, okay, or the thermometer. The weighing machine, you are weighing on the weighing machine for twice or thrice, okay, or you are measuring the temperature for twice or for thrice, then you are taking the readings. Okay. If you are getting the same readings, okay, you are measuring yourself, you are making yours measure by others, okay. वैसे मतलब I mean to say that एक इंस्ट्रूमेंट जो है उसको कोई भी इस्तेमाल करने दो, चाहे वो मैं इस्तेमाल करूं, चाहे वो आप इस्तेमाल करें, ये कोई भी इस्तेमाल करें, चाहे वो एक वेइंग मशीन हो या एक बीपी मशीन हो या एक टेम्परेचर वाला मशीन हो, वो रीडिंग्स सेम. जितने भी उसमें रीडिंग्स आते हैं वो सेम ही आएंगे, ओके. एक व्यक्ति का नॉर्मल टेम्परेचर हमें असेस करना है, तो उस व्यक्ति का टेम्परेचर चाहे मैं चेक करूं तो उतना ही आएगा, या वो व्यक्ति का मैं वजन चेक करना चाहती हूँ वजन की मशीन से या वेइंग मशीन से, तो मैंने चेक किया 50 आया, वो आपने भी चेक किया 50 आया, वही वेइंग मशीन से. आई एम नॉट टेलिंग अबाउट यूजिंग द अनदर वेइंग मशीन. With the same weighing machine, if we are using it and repeatedly हम उसको यूज करते जा रहे हैं और हमें सेम कंसिस्टेंट रिजल्ट मिल रहे हैं, उसको हम क्या कर रहे हैं उसको हम क्या कर रहे हैं, we are calling it as what? Reliable. Okay. Next, who is this roll number? वैलिडिटी में जिस काम के लिए बना है उसी के लिए इस्तेमाल कर रहे हैं, वो बनता है वैलिडिटी। रिलायबिलिटी मतलब क्या है? वो जिस काम के लिए बना हुआ जो मशीन है उसको हम बार बार चेक करेंगे तो हमें वही बार बार वही हमें मिलेगा, तो इसका मतलब है वो रिलायबल है, वो सही है। ओके, फॉर एग्जाम्पल, इवन इफ वी गो टू अ मार्केट टू परचेज समथिंग, like for example, take an example of the mixer grinder, okay, or you can take an example of a mobile phone. Okay, so what you will do, you will start using it, you will start, for example, your mobile phone, better that you can check the Bluetooth example or headphone example you take. So what you will do, you will try to use it, you will try to check it, then you will purchase it, is it not? वैसे ही करते हैं ना आप लोग। कोई भी जब सामान खरीदने के लिए अपन जाते हैं मार्केट बाजार में, तो पहला हम उसको चेक करते हैं। इलेक्ट्रॉनिक आइटम्स मान लो, हैव यू नोटिस्ड? कभी परचेज करने के लिए, बिकॉज you people might have not purchased any appliances and all. So if you are purchasing this headphones, Bluetooths, okay, or any mobile and all, so what you will do, you will first check the functioning, if I am not wrong. Okay, so that you are checking it, you are means you are assessing whether it is working properly or not, because you have seen that all specification somewhere else in the advertisements or in the TV, somewhere else you have seen, that's why you are checking it and you are taking it. Okay, so if you check also, it is the same thing. If another person comes and checks it also, it will be the same thing. So that particular coming same by different persons, it is called as reliability. Got it? So next is the population. So what is population now? A group of people who are going to be studied and to whom should the study result apply. That we are calling it as the population. So now again going back to our yesterday's previous example. So I was taking about the students, nurses. Nurses, I was telling student nurses. I want to assess the knowledge, attitude and practices. Okay. Student nurses of BSc nursing, I was telling, and that too in the 4th year I told, if you remember. So in that one also, same BSc nursing students, there are so many BSc nursing students all over the India. Okay, so there are so many BSc 4th year students also all over the India. Okay, so the group of the people which is being studied all over the India, we cannot do the study, but we can apply the study as a whole. For example, again go back to the example of the COVID vaccination. I was telling that because before giving the vaccination, it was being tested priorly, okay, on some people only. Only some people, what they are doing, that is called as a sample, okay. But the whole people is there, whole thing, whatever the study, whatever they are going to apply, that it is called as a population. Means the India's or the countries, or you may say the world's the people whom they wanted to apply, that was the population, because they wanted to apply the result. Okay, now again come back to our example of the BSc students only. Okay, all over India, 4th year students are there. Okay, if I do the study only on ITM 4th year BSc nursing students, I may say that I can apply it for everyone. So that particular thing, the whole application, the whole 4th year students of the India or the world, you may say. So they are called as the population. The group of people who are going to be studied and to whom the study should result should apply. It is called as what? The population. For example, bedside nurses are the population in research studying and the factors as, affecting their nurses workload. Means these are some of the examples they have given. Means working nurses, that is an example, and their factors they are telling. But in simple way to make you to understand, population means a whole group. Okay, it is a full group people where you want to conduct your study and on whom you are going to apply it. That we are calling it as a population. So now the next terminology comes, that is the accessible population. Okay, so now try to understand. Population is full one big circle you draw. Okay, in that big circle, how many people are there? That you consider as a population. Okay, now you are standing in the center, you think. Okay, you one big circle you have drawn, and with that circle boundary, complete boundary is your population, and you are in the center. Okay, accessible population means which are easily available to the researcher. That we are calling it as accessible population. In simple words to tell you, you are standing at the center. Okay, if you are standing at the center, the nearest thing will be what? The nearest thing will be just beside you, either left side or the left side or front side or back side. Okay, now for example, we are in Gwalior, and in the Gwalior, the nearest means we are staying in Sitoli, but the nearest place for us is either the Sitoli. Okay, then if I consider any city area, means the nearest place is the Gwalior. When I compare it to the other places like Jhansi or Delhi, if I compare, so I am very near to the Gwalior, or I am very near to the village. If I consider, it is a very nearest village is the Sitoli village. So Sitoli is a accessible population to me. If I want to conduct a study, so if I want to say that accessible population means Sitoli will be my accessible population. Why? Means we are taking very easily available subject we are taking, or near available subjects we are taking, that we are calling as that as accessible population. It is not only applicable to the areas, but even if you are doing the research in the hospital also, in the hospital setting also. So in the hospital setting, if you are considering your own hospital, if you are doing the research, that is the accessible population. Means only ITM hospital if you are doing, that is the accessible population. Why? Because it is near to the researcher. Okay. So now this is the next terminology that we are calling it as what? Target population. So now different words you are coming across. Okay. So in the target population. So in the target population, what is this target population? Target population means the entire group of the people or the objects to which the researcher wishes to generalize the findings of the study. Okay. Now I have taken the example of the ITM hospital or the Sitoli village. Okay, so when I say that the whole population is there. Okay, now hospital. Let me go with the example of the hospital only. So I want to conduct a study on the nurses who are working in the hospital. So what I want to study is that whether are they aware about the standard precautions or standard operating protocols. Are the nurses aware or not? So this is my, are they aware in the sense, are they having the knowledge and are they practicing those protocols? There are two variables now, knowledge and practice. These are the two variables. On what? On the standard operating procedures, or you may say the universal precautions. This is the topic. Okay. So when this universal precautions, where I am going to assess it, I am going to assess it on whom? On the nurses who are working in the hospital. Okay. But who are working in the hospital? There are n number of nurses who are working in the hospital. That many nurses are working in the hospital. Even in Gwalior, they are working. Even in ITM also hospital, they are working. There are n number of hospitals in the Gwalior. There also they are working. There are n number of hospitals in Delhi. There also nurses are working. So this all are called as population. But I want to assess on only the people who are near to me. So I thought of taking only the Gwalior district nurses. Okay, only Gwalior district nurses I am taking. Gwalior district nurses, why? Because I am easily accessible to them. So I can go easily to the hospitals wherever the hospitals are there. So that's why I am calling it as what? The accessible population. Now, in that accessible population, it may not be possible for a researcher to go to every one person to person or every one-to-one hospital. So if I consider Gwalior place, there may be so many hospitals. Okay, so I cannot go to every people, but I can select some of the people. So now I selected only ITM hospital people, ITM hospital nurses. So when I say it is only for the ITM hospital nurses, that becomes the target population. Okay, so that particular people are becoming our target population. So when the target population is there, if I test something on the people, this target population, what I can do, I can generalize the findings. Okay, what generalization of the findings means? That can be applicable throughout the hospital nurses. That is what is called as the generalization. Now take one more example of the COVID vaccination only. So when the COVID vaccine was being prepared, so what they did not gave the vaccination to every person. But what they did, firstly, that is the whole India is a population. Firstly, what they took only some particular areas randomly which they had taken. That is called as the accessible population. Okay. So among the random places selected, they took some of the people. Okay, that is the target population. Okay, 1, 2, 3, 4 members somewhere else they took. Those were the volunteers, though they were the volunteers, but they were the target population. So what they did, they injected the vaccine on those people. After giving the vaccination on those people, they were waiting for the signs and symptoms to come. Any reactions are there or what? Then they did not find anything. Then when there was less number of signs and symptoms of the side effects, then they said that there are no any side effects, so we can give the vaccination to the all. So giving the vaccination to the all indicates generalization. Okay, so means we can apply this to every one. Application is called as what? Generalization of the findings. So always, मतलब हमेशा हमारा स्टडी क्या होना चाहिए? जब भी हम कोई स्टडी करते हैं, जब हम वो स्टडी करने के बाद वो स्टडी ऐसा बनना चाहिए कि वो दूसरों के लिए भी, यहाँ नहीं, हम ग्वालियर में उतना ही नहीं, हम दिल्ली में अप्लाई करेंगे तो भी यही आने वाला है हमारे लिए. ओके, या हम जाके मुंबई में भी वो स्टडी अप्लाई करेंगे तो भी हमें हमारा फाइंडिंग्स में यही मिलने वाला है. देयर मे बी लिटिल अप्स एंड डाउन्स, बट हमें क्या मिलने वाला है? सिमिलर रिजल्ट्स मिलने वाला है. ओके, now you can take one more example of NaCl, या sodium chloride. Okay, what we say for that, NaCl or the sodium chloride. So the normal word which we call it as a salt. Okay, if I dissolve that salt in the water, it will get what? Dissolved. If I dissolve it in the collier, will it get dissolved? So next thing is the sample. Okay. Oh, now what is sample? हम लोगों ने पॉपुलेशन देखा, पॉपुलेशन जो था पूरे लोग थे, एक्सेसिबल क्या था, जो रिसर्च के लिए आसानी से अवेलेबल हैं, टारगेट क्या था, उस एक्सेसिबल पॉपुलेशन में फिर किसको टारगेट कर रहे हैं, वो था टारगेट पॉपुलेशन। और अभी आता है सैंपल। सैंपल का मतलब आई गिव यू द एग्जांपल ऑफ अ स्वीट मार्ट। Okay, whenever you go to a sweet mart, so they will give you to taste something. Okay, so based on that, what you will tell, it is good, like that way, and you will be taking it. In the same way, in the research also, on the whole population, okay, among the accessible population, what part only we are taking, ओके, मतलब एक बड़ा सा जो पॉपुलेशन है उसमें कुछ ही लोगों को हम ले रहे हैं, तो उसको हम क्या कहते हैं, सैंपल कहते हैं। अभी आई गिव यू द एग्जांपल ऑफ अ ड्रग ट्रायल। ओके, फॉर एग्जांपल अभी कोविड वैक्सीनेशन में पूरी इंडिया जो था वो पॉपुलेशन था, इंडिया के लोगों में जो वो लोग कहीं 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 स्कैटर होके ले लिया था, कुछ लोगों को, वही है हमारे सैंपल्स। ओके, so sample are those persons in the population from whom data will be actually collected and from whom generalization about the population will be made। मतलब क्या है, पॉपुलेशन में सैंपल किसको कह रहे हैं हम, उसमें कुछ ही लोगों को जो हम सेलेक्ट कर रहे हैं, काई के लिए सेलेक्ट कर रहे हैं, ताकि हम एक्चुअली उन्हीं के ऊपर टारगेट करके उन्हीं से हम लोग डाटा ले रहे हैं, डाटा लेना या उनके ऊपर हम रिसर्च कर रहे हैं, और उनसे जो रिसर्च किए वाला जो रिसर्च आएगा उसको हम क्या कर रहे हैं, जनरलाइजेशन कर रहे हैं। जनरलाइजेशन का मतलब क्या है कि हम सब लोगों को उसको अप्लाई कर पाएंगे, तो उसको क्या कहते, उस पर्टिकुलर जो सैंपल जो लोग हैं जिसपे ऊपर हम रिसर्च कर रहे हैं, जिससे हमें रिसर्च आउटपुट मिलने वाला है, तो उनको क्या कहते हैं, अपन सैंपल कहते हैं। ओके, देन सैम्पलिंग, the process of selecting the samples from the target population to represent the entire population is called as what, sampling। मतलब try to understand the differences between the sample and the sampling। एक बड़ा सर्कल है, बड़ा सर्कल के अंदर जो आपको आसानी से अवेलेबल थे वो लोग बन गए आपके एक्सेसिबल पॉपुलेशन, और उस एक्सेसिबल पॉपुलेशन में जो आप देख पा रहे हो, जो टारगेट कर पा रहे हो, बहुत सारे पॉपुलेशन थे, मतलब हमारे इंडिया में करोड़ों पॉपुलेशन है, करोड़ों पॉपुलेशन में आपको क्या देखना था, आपको देखना था कि नर्सेस को, नर्सेस की नॉलेज को आपको असेस करना है। तो इंडिया में बहुत सारे नर्सेस ऐसे लोग हैं, तो नर्सेस, ओनली नर्सेस जो ले रहे हैं वो बन गए हमारे एक्सेसिबल पॉपुलेशन। ओके, आई मीन टू से दैट इज अ पर्टिकुलर पॉपुलेशन। ओके, उस नर्सेस में जो है, हम लोग ओनली ग्वालियर का नर्सेस ले रहे हैं, तो ग्वालियर का नर्सेस बन गए हैं हमारे एक्सेसिबल पॉपुलेशन। तो ग्वालियर के नर्सेस में हम कहाँ पे एक्सेस करने वाले हैं, ग्वालियर में, चाहे वो हम नजदीक की जो हॉस्पिटल्स है वो कर रहे हैं, तो नजदीक का हॉस्पिटल कौन सा होगा, अपना आईटीएम हॉस्पिटल होगा, तो आईटीएम हॉस्पिटल क्या बन गया हमारा, टारगेट पॉपुलेशन। आईटीएम हॉस्पिटल में बहुत सारे नर्सेस है, करीबन 100 नर्सेस होंगे मान लो। ओके, सो 100 नर्सेस के लोगों में हम सबको तो नहीं कर रहे हैं, कुछ ही लोगों के ऊपर कर रहे हैं, कुछ ही लोगों को ऊपर कर रहे हैं, वो बन जाता है हमारा सैंपल। ओके, और वो सैंपल को जो हम सेलेक्ट करने का जो प्रक्रिया है उसको वो बनता है हमारा सैंपलिंग। So next comes the abstract. Okay, so what is abstract? A clear, concise summary of the study that communicates the essential information about the study. So that is called as abstract. Abstract का मतलब क्या है? जब हम स्टडी करते हैं, पूरा स्टडी हमारा जब खत्म हो जाता है, खत्म होने के बाद एक तरह का हम इसको छोटी सी शब्द में कहने के लिए हम कह सकते हैं इसका सारांश. ओके, आउटकम क्या है? ओके, नाउ टेक एन एग्जांपल ऑफ अ फिल्म. ओके, आप लोग कोई फिल्म देखने गए होंगे समझ लो, तो 3 घंटे का जो फिल्म रहता है या 2.5-2 घंटे का जो फिल्म रहता है, तो उसको आप कितने समय में बोल पाएंगे? कम से कम समय में पूरा पिक्चर आप उसमें दिखाओगे. यस, means if we want to explain that film or if you want to tell the story of that film to your friend, will you explain it for a period of 2 hours or 3 hours, whichever you have seen continuously? Is it possible? Then what you will do? Is it not? So we are going to make it in a concise form and we are going to tell in a summary form. So that we are calling it as what? Abstract. So next comes the variables. Okay, so what are variables now? Means variables already we have studied in our previous slides. Okay, so variables which are being measurable, which are observable, that we are calling it as what? Variables. Now, when we do the research study, there may be many different types of the variables may be found. Okay, so like for example, dichotomous variable. Dichotomous means there are two variables. Attribute variable means which we are going to assess them. Active variables which are really active. Then we can say that there is a dependent variable, there is an independent variable, then there is an extraneous variable. So we will be seeing them one by one when we study an unit. There is a unit on sampling and everything and all. That time we can go in depth with this all things. So as I told you, dichotomous variables means what? The variables that vary in only two values. Okay, there are only two values. For example, you may take male versus female. Okay, alive versus dead, day versus night, height and weight. Okay, so only there are what? Two variables that we are calling it as what? Dichotomous variable. For example, you may take knowledge, attitude, knowledge, practice. Yeah, attitude, practice. Okay, so these are the variables. Next, speaking about the attribute variable. In the attribute variable, that is, there is a pre-existing characteristics about, means there is some characteristics which are existing, or we can say that age, sex, okay, where the researcher simply just want to observe and measure it. For example, age can be different age criteria we can make. But if you see the dichotomous variable, males are grouped in one, females are grouped in one. Okay, alive are grouped in one, dead are grouped in one, lost people are grouped in one, profit people are grouped in one. Means two variables we are taking, that is a dichotomous variable. Attribute variable means they are having certain attributes or some characteristics they are having. Okay, that are called as what? For example, you may take the age or you may take the sex also. So these are what they are having certain characteristics. Age is having certain characteristics. Age means it may be zero, first 1 day also, 1 day baby is also called as an age. Okay, yeah, 1 year people are also called as age people, or you may take 100-year people are also called as, but they are having their own characteristics. Okay, so that particular thing, when we speak about the sex, only sex we are telling here. It might be male, it might be female, or it might be transgender. Okay, so that attributes means they are having the characteristics. Male are having this characteristic, female are having their own characteristics, and the transgenders are also having their own characteristics. The next variable which we call it as the active variables. So what are active variables? Active variables means variables that do not pre-exist. So the researcher has to create them. Okay, means while doing the research, what the researcher will do, the researcher is creating something. Those are called as what? Active variables. Means they are not in the present in their research. So if the researcher is testing the effectiveness of 4 drugs on blood pressure, here all the 4 drugs are considered as a variable that varies among the individuals. Whereas ones are taking the different drugs, drugs. I mean to say that यहाँ पे क्या है, एक्टिव वेरिएबल्स का मतलब क्या है, वो है नहीं है बल्कि उसको रिसर्चर बना रहा है, हमारे स्टडी में है नहीं है बल्कि हम उसको क्रिएट कर रहे हैं, उसको हम क्या कह रहे हैं, एक्टिव वेरिएबल्स कह रहे हैं। तो उदाहरण तौर पे आप ले चलिए, हमारे पास 4 दवाई है जो बीपी के लिए दिया जा रहा है, वो हमारा बन जाते हैं वेरिएबल्स में। ओके, और वो 4 दवाई जो है, ओके, दे आर ऑल कंसिडर वेरिएबल, बिकॉज ये चारों ड्रग्स को हम लोगों में देंगे तो उनका अलग अलग इफेक्ट रहेगा। बल्कि एक और कोई ड्रग है, 5वां ड्रग, जो कोई और अलग कुछ ले रहा है, तो वो बन जाता है एक्टिव वेरिएबल। ओके, so the next the concept is the dependent and independent variables. So before also we have studied dependent and independent. Independent variable means what? Independent variables are always manipulated variables. Manipulation is possible in the independent variable. So I gave you the example of health education. Okay, health education, or you may say, you also told me that you earned the COVID about the corona and all through the TV, through the articles, through the friends, through the health workers. So these are all the independent variables. So these can be manipulated. Okay, so why it is manipulated? I may say that the health education which I have been given is very effective to say that I can modify it however I want. Health education can be given orally also. Health education can be given by demonstration also. Health education can be given through showing the videos also. Okay, so these are the various things I can do that can be manipulated. It means, okay, so variable that is believed to cause or influence the dependent variable means what the independent variable is doing. Independent variable is influencing the dependent variable. So the health education which I am going to impart for what purpose? For the purpose of knowledge I am imparting it, because the knowledge want to be increased. That's why. So what the process of manipulating this is the independent variable, and which has been influencing is the dependent variable. So what is dependent variable now? Dependent variable, also called as a criterion variable, and this is influenced by the independent variable. Okay, that is called as a dependent variable. Here you can see in a chart the example of the dependent and independent variables. So does smoking cause lung cancer? Okay, these are some of the examples. Does nursing care cause rapid recovery? Does drug A cause improvement? Yeah, cause effect independent and dependent variable. So you can see here. Now what we are saying, does smoking cause the lung cancer? This does is there, smoking is there, cause is there, and lung cancer is there. Okay. So now lung cancer is a dependent variable. Why it is dependent variable? We know that lung cancer is a disease, okay, which will happen. Okay, it is happening because of what? It is happening because of n number of factors are there, but the one factor which we are taking here, that is the smoking. Okay, all the smoking people will get the cancer or lung cancer or what? So it is not, we cannot say that all the people who are smoking will get the lung cancer, or we may not say that all the nursing care which we are providing to the patients are having the rapid recovery. But we say that the good nursing care will cause the rapid recovery. This is our assumption. We are thinking, yes, a good nursing care gives a good recovery. Similarly, a good drug will give us the good improvement. Okay. So whatever the things which are we are implementing, which are we are telling that this is what is there, that is the cause, and the means what is happening, means does what we are asking the question here, does smoking, does nursing care, does drug, ये जो smoking है, ये nursing है, ये drug है, they are all the causes, कारण है ये एक तरह का. ओके. इन कारणों से क्या हो रहा है वो बनता है इफेक्ट. जो कारण है वो है हमारा इंडिपेंडेंट वेरिएबल, और जो हमारे इफेक्ट है वो है हमारा डिपेंडेंट वेरिएबल. और इंडिपेंडेंट वेरिएबल को हम हमेशा मैनिपुलेट कर सकते हैं. मैनिपुलेशन इन द सेंस क्या है, हम उसको अपने तरीके से हम बदल सकते हैं. क्योंकि जैसे स्मोकिंग कह रहे थे हम, स्मोकिंग करने वाले को भी कैंसर हो सकता है, स्मोकिंग नहीं करने वाले को भी कैंसर हो सकता है. दिस इज व्हाट इज द मैनिपुलेशन. नर्सिंग केयर देने वाले को भी रिकवरी है, नहीं देने वाले को भी रिकवरी है. ड्रग दवाई खाने वाले को भी सुधर रहे हैं, नहीं खाने वाले भी सुधर रहे हैं. तो दिस इज कॉल्ड एज द मैनिपुलेशन. कि ये जब मैनिपुलेट करेंगे वो सीधा किस पे असर दिखा रहा है, कॉज पे असर दिखा रहा है. ओके. दैट जो कॉज जो हमारा हो रहा है वो सीधी सीधी किस पे दे रहा है, इफेक्ट दिखा रहा है. ओके. सो दैट इज द डिपेंडेंट वेरिएबल. The next comes the extraneous variable. Extraneous variable means variable that confounds the relationship between the dependent and the independent variables. Thus, it needs to be controlled. कभी कभी क्या हो जाता है, जब हम रिसर्च करते रहते हैं, अभी उदाहरण मान के चलिए, हम कॉन्स्टिपेशन है, पेशेंट कुछ ग्रुप ऑफ पेशेंट्स हैं, कॉन्स्टिपेशन से वो सफर कर रहे हैं, तो आप उनको क्या करने के लिए जा रहे हैं, उनको कॉन्स्टिपेशन रिलीव करने के लिए आप एक रिसर्च स्टडी कंडक्ट कर रहे हैं. तो उसमें आप क्या करेंगे, कुछ लोगों को आप लोग क्या करेंगे, हाई फाइबर डाइट देंगे, और कुछ लोगों को आप कुछ भी नहीं देंगे. ओके. तो जब आप कुछ लोगों को हाई फाइबर डाइट देते रहते हैं, तो उन लोगों में कोई कुछ लोग होते हैं जो बिना बताए वो लोग दवाई खाते रहते हैं. ओके. दवाई इन द सेंस वो हाई फाइबर डाइट के साथ में और कुछ दवाई भी खा रहे हैं. जो बिना बता के कुछ खा रहे हैं, मैंने कहा ना, दवाई हो या जो भी हो, तो उसको कहते हैं कंफाउंडिंग वेरिएबल. ओके. सो दोज आर द एक्सट्रोनियस वेरिएबल और द कंफाउंडिंग वेरिएबल्स. सो ये सीधी सीधी क्या कर सकते हैं, हम हमारे रिसर्च जो हम कर रहे हैं उस पे इफेक्ट कर सकते हैं. तो इसीलिए ऐसे कंफाउंडिंग वेरिएबल्स को कंट्रोल करना एक रिसर्चर को बहुत जरूरी रहता है. ओके. जब भी रिसर्च कंडक्ट करते हैं तो रिसर्चर जो है अपना एक्सपेरिमेंट करने वाले लोगों को बताते हैं कि इस एक्सपेरिमेंट के दौरान आपको इतना ही करना है, इसके अलावा आप यदि कुछ कर रहे हैं तो आप हमें बता दो, या आप कुछ दवाई वगैरह नहीं खाना चाहिए इस दौरान. तो दैट पर्टिकुलर थिंग विच द अदर थिंग विच इज बीन एंटरिंग इन द वेरिएबल, वी आर कॉलिंग इट एज व्हाट. So that particular variable, we are calling it as what? Extraneous variable. For example, you may take the air pollution is an extraneous variable, interferes with studying the relationship between the smoking, which is the independent variable, and lung cancer, the dependent variable. So now we were seeing the example of in the previous slide, we saw the example that smoking may cause the lung cancer. Okay. But that we are seeing, but there is another variable which may come, that is the air pollution. So because of the air pollution also, people may suffer from the lung cancers. Okay. So that extra which thing are coming in the study, we are calling it as what? Extraneous variable. There are few more terms applied in the research. Okay, so you can just go through the slides also. There are certain empirical data, even there is applied research, basic research, clinical research. Okay, so you can just go through them. I'll be uploading the